update on IVF. Today is April 13th. Just getting ready for work right now. My labs from when I started my period came back like about a week ago. And they tested me for AMH, FSH, CBC, TCH, A1C, and MMR, something like that, right? So I had to take notes, so here's my paper. The AMH count is supposed to be your ovary count, right? If it's good or bad, pretty much if you're running low on eggs or not, right? Your count's supposed to be 1. I was at a 1.43, so that's good. The FSH is the overall quality of your follicles. So that was good. And the only thing that I was like low on was antibodies for rubella. I think that's what it is. So I had to take a booster shot last weekend, which was Easter weekend. And I had to do it right away because they said that once I take the shot, I'm supposed to wait 30 days. They're supposed to wait 30 days until I can get pregnant, right? So obviously I'm trying to get pregnant like ASAP. So I went Easter Sunday because CVS was open Easter Sunday. So I got it done. Yesterday, well, today's what? Today is Thursday. Yesterday, Wednesday, I had an appointment because I had to get the like fallopian tube ultrasound, the fluid ultrasound. So we went yesterday, right? When I tell you that ultrasound hurts, it hurt. Doctor was like, hey, you're gonna feel a little cramping whenever, because they have to insert like water into your uterus for it to expand, and that way they can see if there's anything hiding in there, anything blocking the fallopian tubes, or something like that, right? Oh my goodness. As soon as they put in the water, I felt like my stomach like blew up. It definitely hurt. It hurt for a little bit. It's very uncomfortable. And then after that, they're like, oh, go, you're going to speak to Amy. And Amy went over like the medication, when I'm going to start the medication. She printed out a calendar of when to start the medication. And when I tell you, it was like a lot of information that she was giving us. I was overwhelmed. My anxiety was like really high, more so because she started talking about the injections that I have to do to myself, or, if Jordan's going to help me. 1 in the morning, 1 in the afternoon. And then you have, once after the egg retrieval, you have another shot that goes in the booty. And she said that one's going to hurt. So, I got a little anxious. You should have seen me sitting there. Like, I was like, okay, listening, and trying to wrap my head around it. My hands were getting clammy. I was like, kind of like going back and forth, like, oh my goodness. I'm not looking forward to these shots. And I have tattoos and all that, and needles don't scare me. I just don't like shots, right? So yesterday I was feeling a little overwhelmed by it. I'm supposed to start my medication on the 5th of May. They're going to be sent, like, they're going to be overnight next week sometime. And I go back on the 5th to the doctor. My doctor's going to clear me to take the medication. They're going to make sure that I'm still taking my birth control, because I got to take my birth control all the way up to 5th of May. They're going to check something. I forgot. See, like, I was paying attention, but not really paying attention. And then, yeah, we'll go from there, right? So now I got to wait until the 5th of May. Today is 13 April, so maybe a little over a month. and then we'll go from there. Today is April 19th, and just a little update. Hit a little bump on the road yesterday and today. I went to go refill my birth control because I am on my last 3 days of birth control. And if you've never taken the pills, they have an inactive, that's what it's called, inactive week of pills, and that's supposed to be for when you start your period. As you can see, I only have 3 days left, and according to my doctor, I'm supposed to not take the inactive pills and continue on a whole new set of pills, right? And when I went to try and refill my prescription yesterday, remember I'm active duty, so I was trying to refill it on base. And we have what's called a satellite pharmacy and then the main pharmacy. And the satellite pharmacy is usually for refills where you go pick them up, and then the main pharmacy is where you pick up your initial prescription and things like that. So when I went to the pharmacy yesterday, the satellite, they said, oh, you need to activate your refill. I was like, oh, okay. So I called the hotline because you have to call this number to activate it. And I got a message saying, it's too early for you to refill. The earliest you can refill is on the 24th, which would be Monday. Since I didn't pick this up April 3rd or something like that. And so I couldn't get a refill, and I couldn't activate it or whatever. And then I called the nurse at the clinic, the fertility clinic, and sent her an email, didn't get a reply. I called and I was like, hey, I was wondering you can help me with this refill. And she pretty much said, oh, well, usually the reason why you got that message was because something to do with the insurance. They don't like to refill it right away, or you had to pay for it, something like that, right? But because I'm military, the insurance works a little bit different, because she was saying, well, maybe they can still refill it for you, but you just have to come out of pocket and pay for it. Well, for us, we can't just go to the pharmacy and just give them cash or a card, hey, just refill it for me and then I'll pay for it, right? It doesn't work that way. So I asked her oh, worst case scenario, can you just send me another prescription? I'll go to CVS or another pharmacy and I'll pay out of pocket for it, right? She advised that I go talk to the pharmacy on base and see if they can fill it for me. And so I went, and thankfully they were able to fill it for me, but I had to explain to them hey, I'm going through fertility treatment. My doctor said not to take the inactive pills, but to continue taking the regular ones and not to miss a day. Can you refill it? What can you do for me? She's like, oh yeah, we can do that for you. We'll just override it, right? And I guess they needed my consent to override the request. And yeah, so they override it and I got my prescription. So yeah, 2 more weeks until the 5th of May. I gotta continue taking these. On another note, I actually ordered some stuff from Amazon for my medication when I start my medication. And I actually ordered it today, placed my order for the medication so they can deliver it. I pay for it, essentially, right? I should be getting my medication tomorrow. And so I ordered some stuff. I've been watching some other YouTube videos and things that people get to help with the shots and organized. And so the first thing, I'm actually pretty excited about this. I think these are pretty cool. I got myself some little ice packs to ice the area where I'm gonna get the shot. And I figured I'd get something cute, right? Something that will make me happy when I see it and not worry about these shots. So I actually was looking for heart ones or stars, but I couldn't find them. I don't think I have something sticky on the back. So I got these cute little bears. I'm so excited. There's 4 of them. So you got a yellow, purple, blue, pink, Oh, this sticky stuff. Pink. And this like aqua blue one. These are so cute. I can't wait. I figured, you know, like my son can use them or something. We can use it for something else, you know, not just that, because fortunately my family, we be getting hurt all the time. Me and my son specifically. I don't know, maybe we just clumsy. Something always happens to us. But yeah, these are called Boo Boo Ice Pack. And these are way cute. I'm so excited. I can't wait to use these. And then let's see, let's open the other box. Let's see what we got here. Rip it open. Okay, so then I also got this nice organizer. Sorry about the ruckus. And it's pink. Like a little toolbox. People used to like put beads and jewelry. You can use it for a lot of things, but I've seen a lot of people like YouTube going through IVF have something similar that helps them organize all the vials and the needles and like the alcohol pads, you know, and then they decorate it with like stickers, motivational stickers. So can't wait to do that. Maybe order some from Etsy. I have a Cricut, so I'll probably like do something, put like baby brown or something like that, right? So it looks like this. And you open it and then it goes like that. So pretty excited. My favorite color is pink, so I had to get a pink one. But yeah, I'll show you tomorrow when I start organizing the stuff. And I saw another video saying that it doesn't fit a lot, so I may have to stash the rest on somewhere else. But yeah, that's my update for today.